WFM 91.7.
A beautiful morning to you. Thank you so much for tuning in and staying with us right here on Women Radio WFM 91.7. I hope you had a great weekend. I hope that you were able to rest well. You're feeling good today. You're feeling great today. All right. This is just me hoping that all the Radio Doctor episodes we had last week, at least, if not for anything, it should be able to encourage you to live healthy here, so that days like today, you'll be feeling very energetic. You'll be feeling pumped up to face all that you have to face today. All right. So, yes, this is Women Radio WFM 91.7, Nigeria's first radio station for women and their families. Thank you so much for joining us this morning. This is 6 minutes after 10 on this amazing Monday morning. This is your program, Radio Doctor, which is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on radio right here on Women Radio WFM 91.7. And this program comes to you 10 a.m. Mondays through Friday. All right, my name is Rose Yusuf Kaiser, and of course today our radio doctor is Dr. Olufumilola Akinola. She is a consultant pediatrician at St. Ives Family Hospital. Good morning, Dr. Akinola. How are you? How was your weekend?
Good morning. My weekend was fine, and was yours too?
Oh, it was good, but mine was short shower. It was short, but we thank God for it though. All right, so thank you so much.
I'm happy to be with you this morning.
All right, so we're excited to have you too, as usual. So, Radio Doctor, of course, each day we have for different specialty. Today we look at children's health. Mondays, on Tuesdays, we look at women's health. On Wednesdays, we get to look at general health. On Thursdays, we look at health for elderly, and then on Fridays, we go into general health also. So today is children's health right here on Women Radio. That's why we have a consultant pediatrician with us from St. Ives Family Hospital, Dr. Olufumilola Akinola. All right, so let's head on straight to it. The phone lines, of course, will be open shortly, but in the meantime, you can go through our social media pages, Facebook, Instagram, X, and of course YouTube at WFM 917. Log on to our website www.wfm917.com. You can download our mobile app WFM 917. Okay, you get to listen to us from any parts of the world. All right, so today on Radio Doctor, Dr. Akinola will be consulting and advising on the importance of immunization in children. All right, so we will be looking at this today on Radio Doctor, because at the end of the day, we'll get to understand why immunization is important, while we keep creating awareness around immunization, while doctors and nurses will want to quarrel you when you don't show up for immunization with your kids. When you don't take your children for immunization, they'll go one quarrel you, they'll go draw your ear like this. Why you take these things for granted? And blah, 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 blah. So we want to know why, safe, waiting happen. Why did they take all these things so seriously? In fact, they take it more serious than you, who is a parent or a guardian to that baby or to that child. So that's what we'll be looking at today, the importance of immunization in children. All right, this is Women Radio WFM 91.7, 9 minutes after 10 on your program, Radio Doctor. So let's get on to it, Dr. Akinola. Let's start with what is immunization. So let's understand what immunization is and why it is so important for children's health.
Thank you very much. I'll start by saying that immunization is the process by which an individual system becomes fortified or protected against an infectious agent through vaccination. I will go further to say that vaccine is a preparation that is used to stimulate the body immune response against disease. And vaccines are usually administered through needle injection, but some can be administered by mouth or sprayed into the nose. While vaccination is the act of introducing a vaccine into the body to produce protection for a specific disease. So immunization is when you now is the process by which this vaccine is now introduced into the body to protect or fortify the system, the body system, against infectious disease.
Okay. Thank you so much for giving us that explanation, Dr. Akinola, this morning. This is Women Radio WFM 91.7, and this is the program Radio Doctor, coming to you live from Women Radio. All right, so you can dial the number 07000 917 917. You have questions on vaccinations, immunization for children. Do well to call in. You have concerns. Maybe you're hearing one story that you're thinking, could this be true about this particular immunization? Could this be true about this particular vaccine? Let me just call and find out. So we're here for you. The doctor is here to advise, of course, and for you to ask your questions, okay, on immunizations, especially in children. So do well to call in on 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. So maybe you're hearing lots of stories about a particular vaccine that is being given out to children, or some kind of immunization that children should go ahead and collect, and you are not sure about it. They do, like, say, a foreign story they hear, and maybe some people are reacting differently to it, and you need to ask these questions. Please do well to call in on 07000 917 917. Let's get your questions, your concerns on immunization in children. This is Radio Doctor right here on Women Radio WFM 91.7, 13 minutes after 10. Now, Dr. Akinola with us this morning, joining us virtually, has told us what immunization is, and of course, how important this is to children's health. So, Dr. Akinola, I want you to tell us how this vaccination gets to protect children from serious diseases. How does it work to protect children? If when the vaccines are being given and it has gone into the bloodstream and all of that, how does this work in the children's body to protect them from diseases, so that maybe the importance of this will really sink in very well?
Immunization when you introduced vaccines into the body through immunization, this stimulates the immune system to fight infection faster and more effectively. In children, most young children, the immune system is still very low, and so most of them, and they don't have immunity. The immune system is not strong enough to fight against some of the infectious disease that they are potential of being exposed to in their environment. Immunization or vaccination mimics this disease. So when you introduce it into the body, it builds up the immune system. It seems as if you introduce the disease into the body, and what the body does is to build up immune system, to build up the immune system and build up the immunity, enable to fight against this disease, so that subsequently, when they are now exposed to the real infective agent or the disease, that the body is already prepared to fight this disease, and they'll be able to mop up this infectious agent and clear up the disease, preventing the disease to be harmful to the body. That is what the immunization does.
Okay.
So it strengthens the immune system and help the immune system to fight infection faster and more effectively.
Okay, so if I understand you very clearly, Dr. Kinola, you said it's like introducing some parts of the disease into the body and then getting the immune system to fight it, so that when next or whenever that disease comes, the body is ready to actually fight it.
To fight it, yes, that's
okay.
what it does.
So wouldn't that sound a little bit scary when explaining it to parents? Because I know even during Corona, when they were telling us how the vaccines work, that was the fear of a lot of people. So for parents right now, bringing the children to for immunization, don't you think this will be some of the concerns they have and all of that?
Is the less, what is introduced into the body is not harmful enough, or it's not potent enough to cause disease.
Okay.
It's a sort of the part of the infective agent that is being introduced, and the body now mounts up immunity against it, and body recognize that particular infective agent, so that when the body is exposed to it again, that agent has been recognized and body has been prepared to fight war against it.
Okay.
So what is being introduced is not harmful enough to cause a full disease, or it's not harmful enough to harm the body.
Okay.
Just what part of the agent that is being introduced to sort of make the body prepare to fight off the disease whenever the real agent, if the body comes in contact with the real infective agent.
Okay. All right. Thank you so much for explaining that to us, Tekinola. This is Women Radio WFM 91.7, 18 minutes after 10. My name is Rose Yusuf Kaiser, and of course, this is Radio Doctor, your free health consultation program where real doctors advise real people. Now, today is we're looking at Children's Health Today, which we do every Mondays on Radio Doctor. Children's Health Today, and we have a consultant pediatrician at St. Ives Family Hospital, Dr. Olufumilola Akinola. She's with us this morning, and we are talking on immunization, the importance of immunization in children. So you have questions, you have concerns on this, please do well to call us on 07000 917 917. All right, you can send a text or a WhatsApp message 070 317 56537. Those are the numbers to get in touch with us this morning on Radio Doctor. All right, so now we've seen how this vaccination actually works to protect children from serious diseases. All right, now let's move on to the role that immunization play in preventing the spread of infectious diseases in communities, especially for children. So we have this particular let's say in a community there's this disease that is spreading around and there's vaccination for it. So how does that vaccination actually help in preventing the spread of such infectious diseases in communities, especially communities that are very closely tied? So how does this work, Dr. Akinola, in such environments, especially for children?
Immunization saves lives in the community. It protects you, your child, your children, and also the community as a whole against infectious disease. When there are some disease in which when children are vaccinated, a lot of group of children are vaccinated in that community takes immunization against that disease, produce a sort of herd immunity against the spread of that disease from one child to another. So through immunization, it protects future generation by eradicating disease and in the community. So through herd immunity, when a lot of children in a community take the vaccine against a particular disease, it strengthens the immunity against that disease within that community, and sort of protect the community and the future generation, and also eradicate the diseases. That particular disease in that community.
Okay. All right. Thank you so much, Dr. Kinola, for that. 21 minutes after 10, right here. This is Radio Doctor on Women Radio, WFM 91.7. So, Dr. Kinola just told us the role that immunization play in preventing the spread of infectious disease in communities. All right, so let's look at the overall well-being and development of a child. How does vaccines contribute to the child's overall well-being and development? Because once a baby is born, I'm sure that there are vaccines that they get to roll out. Once a baby is born, maybe after 3 months or 6 months, you come back for some. After a year, you come back for some. So how does all of this come together to help in the child's overall well-being and development? Because what we're trying to do here now is to make parents understand how important vaccination is in children.
Overall, vaccination or immunization prevents life-threatening disease in people of all ages. It helps children to live longer and to have healthier life. It reduces the development and severity of disease when children are immunized. Even if some of them are exposed to this disease and they later develop the disease, probably their body is not able to mount up enough immunity. It prevents them from having severe form of that disease, which may be life-threatening. But it prevents having the severe form, eventually prevents, them from death. And overall, it is very important because it prevents the childhood morbidity and mortality. I mentioned earlier that infants are the greatest risk of disease because their immune system are not fully developed. But when children are immunized or vaccinated, it prevents them from having severe form of this life-threatening illness. And overall, it prevents morbidity and mortality in our children, especially children from 1 year to under 5 years.
Okay. Okay. So from 1 year to under 5 years, Dr. Kinola, is there any vaccination or immunization that should be taken for granted, especially in those crucial years of a child's growth? Is there any vaccination that you think, oh, well, this one is not that important, this one is the one that you should really make sure you go for, or parents should try as much as they can to see that all vaccinations or immunizations are actually taken seriously?
For children of under 5 years, all vaccinations are important, and especially all vaccines that are available to prevent infectious disease. As at now, we have vaccination against polio, diphtheria, tetanus, hepatitis B, rotavirus, and all these vaccinations, they are made available free at our various health center. So I'm sure our government know the importance, and the healthcare stakeholders, they know the importance of all these vaccines. That's why they make it important. Make it available. Provide it free for these children so that they can be vaccinated. They can get access to it and be vaccinated against this childhood infection. So all these vaccinations are important, and they are started from birth, till they are 5 years. So each one have its schedule. So parents should be ensured that they make their children available at the right time to be able to receive these vaccines.
Okay. All right. Thank you so much, Dr. Akinola. This is Women Radio WFM 91.7. Do well to call us on 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. Let's get your questions, let's get your concerns, all right? Or you want to debunk any sort of untruthful talk that you have heard about immunization and vaccination in children, on any of them at all, please do well to call us up. Let's get to hear and get to either debunk it or try to make you understand how these vaccines work. Okay, the doctor is here and she's here to advise, she's here to consult for free, so do well to call on 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. This is Women Radio WFM 91.7, and it's about 28 minutes after 10 right here. And this is the program Radio Doctor, your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on Women Radio right here on WFM 91.7. All right, and this comes to you 10 a.m. Mondays through Fridays. And today I have with me Dr. Olufumilola Akinola, a consultant pediatrician at St. Ives Family Hospital, and she's here consulting and advising for free on Radio Doctor. Today is on children's health, and we would love to definitely hear from you, your thoughts, your concerns, and your questions on immunization in children. That's our topic for today. So do want to call us up on 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. So if you're just joining us this morning, Dr. Akinola has told us what immunization is, how important this is for children, and how vaccinations actually get to protect children from serious diseases, and the role it plays in preventing the spread of infectious diseases in communities. How this actually gets to contribute to the overall well-being and development of children. And of course, now we're about to hear some of the potential consequences, because just a minute ago Dr. Akinola was telling us that parents should try as much as possible to avail your children for immunization at every point that they've been asked to come back for it or go for it. So it's not something that you will sit down and decide and say, oh, this immunization I beg, I no go collect, my pikin no go collect. So it's not something you get to decide, because at the end of the day that gets to affect the overall well-being of your child, if not now, maybe in the future. All right, so now Dr. Akinola, let's come back to you. What are the potential consequences of not vaccinating children against common preventable diseases? So what happens? What happens to these children? And without the vaccination, if they get to have some of this disease that spread around, how does their body get to react to it without the vaccinations? And does that mean that, and okay, let's just start with this question first of all, and then I get to actually the second one. All right, yes, Nakira, let's get to hear some of the potential consequences of not vaccinating your children against some of these preventable diseases.
Can you repeat the question again?
Okay, so I was asking what are some of the potential consequences of not vaccinating children against common preventable diseases?
Okay. Uh, if child is not vaccinated uh, at all against some of these infectious agents, the child is at risk of becoming seriously ill or even dying from childhood diseases such as measles, whooping cough, mumps, area. There are vaccines against these serious infectious agents. But if due to one thing or another, your child does not benefit from this vaccination, then you are exposing your child to the potential of contacting this infectious agent, and there's risk of becoming seriously ill because the child does not have immunity, to fight against this disease. So the child may be seriously ill, and he may even die from the childhood disease. But why are you taking this risk when the vaccines to prevent this disease are available at a very free or at no cost at all in various centers that are nearest to you? So it is important that we vaccinate these children. So because of the potential of exposing them to serious illness and even death.
Okay. All right, thank you very much. And with vaccination, so what Dr. Kinola just saying, with vaccination, you get to prevent all of these things from happening. Just prevents complications for yourself. So that's why, when they say prevention is better than cure, this is just a perfect example of it. All right, thank you so much, Dr. Akinola. Now let's see. In what ways does immunization help reduce healthcare costs for families and society as a whole? Because at the end of the day, if you're saying come and take immunization to prevent some kind of disease, and then later on I still have to go to the hospital, maybe for one illness or the other, and then I get to ask myself why the vaccination in the first place. But overall, in what ways does immunization help to reduce healthcare costs for families and the society as a whole, especially for children?
I mentioned earlier that immunization saves lives. It protects you, your children, your family, and even the community against infectious disease. It protects future generations by eradicating disease. A lot of infectious diseases are now eradicated, and some of them are now rare, as a result of immunization program. Immunization also helps people of all ages to live longer and healthier life. It's by reducing the development and severity of infectious disease. It reduces the prevalence of childhood diseases such as polio, measles, and diphtheria, tetanus. It reduces infant mortality and morbidity. And immunization and vaccination, is an important public health intervention and constitutes a cost-effective strategy to reduce both the morbidity and mortality associated with infection and diseases. over 2 million deaths they are delayed or prevented through immunization each year worldwide. So it is very important and have a lot of benefits to each individual and also the community as a whole.
Okay. All right. Thank you very much, Dr. Kinola, for this. Now, are there some immunizations that you would have to take after maybe you take the first one, like when we had coronavirus, they'll tell you come for the first dose, second dose, third dose, booster dose, all of that. So for immunization for children, are there some immunizations that you have to keep coming back to take the same immunization, or it's just once you take it once and for all, that's it?
Yes, most immunization, you may need to take 1 or 2 or 3 doses to in order to fully benefit from the effect of the vaccination or the effect of the immunization process. Some, you have to take the first dose, then give you an interval for at least 4 weeks or more to take the second dose. Then some may need to come for the third dose, and even some may have to come, maybe years or months later for the booster dose. For example, tetanus vaccine, you will take it at the first dose is taken for the 6 weeks of life, though in combination with other vaccines like diphtheria, pertussis, for children to avoid the having several jabbing of several vaccination, at the same time. Some of these vaccines are combined together and are given at once, to prevent the process of having several vaccination or inoculation at the same time. So for tetanus, you take at 6 months, or some of these vaccines like diphtheria, pertussis, tetanus vaccines, hepatitis B, you take at 6 months. Then you take at 10 months, which is 4 weeks later. Then also take at 14 months to be able to get the full effect, of the vaccines. So after that, you take a booster dose at 18 months, when the effect is going down. Then at 5 years, or anything for 5 years, 6 years, it is also expected to make your child available to take another booster dose, of these vaccines. So to be able to have the full benefit of protection against the specific diseases. So, in other words, except for flu, most vaccines you may need to take several doses to get the full potential, of that specific vaccines.
Okay. All right, thank you very much for that. So that means whatever vaccines you're taking, you need to make sure that you complete it totally so that you will definitely get to benefit from it. And this is not just for kids alone, it's for everybody who needs to take a vaccine, one vaccine or the other. All right, so thank you so much, Dr. Kinola, for that. This is 20 minutes to 11. My name is Rose Joseph Kaisero, and this is the program Radio Doctor, your free health consultation program where real doctors advise real people. All right, today we have Dr. Olufumi Lola Akinola, a consultant pediatrician at St. Ives Family Hospital. And today she's consulting and advising on the importance of immunization in children. So do want to call us up on 07000 917 917. You have a question, you have concerns that has to do with immunization for children, please do want to call 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. Those are the numbers to get in touch with us this morning for your questions, your concerns on the importance of immunization in children. All right, so Dr. Akinola, I know as a doctor, as a consultant pediatrician, over the years, I'm sure you must have heard a lot of misconceptions about childhood vaccination. So what are some of the common ones you've heard? Misconceptions about childhood vaccination, and how can this be addressed, or rather how did you address such misconceptions? Because I'm sure that parents must have come to you with concerns. Doctor, they said if my child takes this vaccine, this and this and this will happen. Is it true? How do I go about it? Is it by force that this child must take this vaccine? Doctor, I don't want anything to happen to my baby, and all of that. So what are some of the common misconceptions you have heard about these childhood vaccinations, and how did you address it, or how do you think this can be addressed?
There are several misconceptions about vaccines that people think about vaccines. Some of these include that some parents have the fear that vaccines can cause side effects such as severe illness, cause deaths when they keep their child vaccines. Some even feel that when they keep their child is to sterilize or to cause infertility in their children. But all these, they are not true. They are not, there is no, what will I say? There's nothing to support all this. There's no fact to support all these misconception. Vaccine is supposed to prevent illness. That is what we have been talking about, throughout the start of this program. So they don't cause illness. Rather, they prevent illness and they prevent severity. Even if your child eventually have that illness, it's supposed to prevent severity. Severe forms of the illness. For example, some babies, they think, if they don't have measles vaccine is supposed to be taken at the age of 9 months. Some of them, if they don't have these vaccines, if eventually comes down with measles, they may have very severe form of this illness, which may be life-threatening and may eventually lead to death. But even if after having vaccines, because now you have booster dose of measles, let's say your child even have one dose and it doesn't have the opportunity of having the second dose or the booster dose before it comes down to measles, it may not, the likelihood of having the severe form of the illness of the illness is zero. There is, may not, that child may not come with the severe form. It may just have rash. But a child that is not vaccinated, is at a potential risk. It's as if you are just exposing this child to the danger of the infectious disease. So, vaccine does not cause illness, it does not cause death, and it does not cause sterility. There is no association of vaccine causing sterility in children or probably in adulthood. It doesn't cause that. A lot of people have had vaccine and they go about having children of their own. So this, I don't know where this conception comes from, but vaccine don't cause all this. During vaccination, you may have a slight pain, at the site of the vaccine. Some of the side effects that are common, and a slight pain, and after taking painkiller, paracetamol, the pain goes away. Some vaccines are known to be associated with fever. The child may have slight fever after the vaccine, but it's not all vaccines that the child will have fever. But there are some are known that to be associated with fever. Measles vaccines, may be associated with fever. So most of the time, mothers would have been educated, and they have been pre-warned, and they will inform them, give paracetamol, to your child when you notice fever after the vaccines. Some of them, there may be slight swelling at the site of the vaccine.
Yeah.
And this can be taken care, So these are the side effects, of having vaccination. But the misconception of serious illness, death, or infertility has not been proven.
Okay. So there you have it. All these are just misconceptions and none of these have been proven. So please go ahead and take your vaccinations and make sure your children take their vaccinations, as at when due. So none of this is going to happen to them. Yes, like Dr. Kinola said, you have a little fever. That's even if you get to do that, it could easily just go away. So there's actually nothing to worry about. All right, Dr. Kinola, thank you so much for that. Now, what are some of the long-term benefits of childhood immunization in preventing complications and disabilities later in life? Okay, because sometimes some of the immunizations you take as a kid may take you all through, all through your adulthood. So let's get to understand how this actually gets to benefit adults. You were immunized in your childhood, and even at your adulthood, you get to find out that, there are some diseases that are going around that you just feel, I haven't done it. It's not knowing that, okay, yes, you were probably immunized when you were still little. So what are some of the long-term benefits of childhood immunization in preventing complications?
There are lots of benefits from immunization. Some of these childhood immunization, if they are taken at childhood, they give you a long life immunity. Some of these childhood, if you have the benefit of having the full dose, of the vaccines, and they can also give you protection, throughout your adulthood, and some of them just need 1 or 2 booster doses, maybe after 10 years of having the initial dose, to be able to, just to prevent against the childhood disease. For example, if you have a full dose of hepatitis B vaccines, in childhood, then you are covered against, you know, hepatitis B infection. You know, it gives you immunity. And for a, if you are as an adult, if you complete your childhood vaccines, tetanus, then in adults, you just need about 1 or 2 doses, especially uh, a woman of childbearing age. Then you continue with what you had from the childhood to have a full protection against tetanus, even in pregnancy. So some of these childhood vaccination serve as a basis, you know, in which in adults just have to get booster dose, and it gives you a continuous
Protection.
immunity against protection against those specific diseases.
Okay. All right. Thank you so much, Dr. Akinola, for that. So let's have your final words when it comes to immunization and, taking vaccination seriously, and how this could actually, help to achieve overall health goals and help in reducing child mortality rate, because we talked about it like twice, but at the end of the day, we want to make this a usual habit of taking immunizations at the appropriate time, especially for children, to reduce child mortality rates. You have mentioned that already. So let's have your final words on the importance of immunization in children.
The immunization is very, very important. Immunization saves lives. It protects you, your children, your family, your community against infectious disease. It prevents life-threatening disease and helps people of all ages to live longer and healthier lives, and reduce the development and severity of disease. And in children, it reduce infant mortality and childhood under 5 mortality rates. So it is very, very important, because it stimulates the immune system to fight infection faster and more effectively. And most of these vaccinations, especially most of these vaccines, especially the childhood vaccines, if it's taken from the child, it's free and it's available our healthcare facility, especially the government healthcare facility. So it is important that to make our baby available to be able to have these vaccines to prevent them from exposure to this infectious disease.
Okay.
And a child that is vaccinated is presented, and the more children we are having vaccination, then it increases the herd immunity of the community. Prevents community. If a household is prevented, and we have many households having their children being vaccinated, then we have the community preventing disease, and worldwide we prevent all these childhood diseases. An effective vaccination can eradicate some of these infectious diseases.
Okay.
So why not make your child available and let them have these vaccines? And it is better to prevent rather than cure.
Okay. Thank you so much, Dr. Akinola, for being a part of our program today and advising us on how important immunizations are, especially in children. Thank you so much.
Thank you for having me.
All right. Do have a great day and enjoy the rest of the week.
You too.
Okay, so there you have it. You have heard it from the consultant pediatrician, Dr. Akinola, this morning, advising and telling us about the importance of immunization in children. So I hope we take this seriously. I hope we don't take this for granted. Let's try as much as we can to make our children available for immunization. All right, so that's it on Radio Doctor this morning. Join us again tomorrow at 10 for another episode of Radio Doctor, which will be looking at women's health. My name is Rose Yusuf Kaiser. A very big thank you to Dr. Olufumilola Akinola, a consultant pediatrician at St. Ives Family Hospital. And thank you all for tuning in and listening to Nigeria's first free consultation specialized radio health program right here on Women Radio. My name is Rose Yusuf Kaiser. Do have a blessed and amazing day ahead. Good morning.
To sponsor this program,
WFM 91.7.